healthcare, we got a lot of those. So David Bolden and I from Advize, we were recently, last week we were out at the Advanced Practice Provider Executives Conference in Utah, which was stunning. Utah is amazing. And we were both presenting. And this is David Bolden, and I'm going to let him tell you who he is and all the wonderful things that are about him.
Awesome. Hello, everybody. I'm David Bolden. I'm with Advize Health. I'm a Coding and Documentation Auditor. Like Julie said, we went out to the Apex conference and had an amazing time working alongside all the APPs and kind of learning some of the issues that they're, challenged with in their day-to-day operations. So very excited to be here. Very excited to talk to you guys about some of the things that Advize is going to hopefully help APPs with in the future.
And I'm Julie Janeway. I'm the General Counsel for Advize Health. I'm also the Director of the Business Administration and Operations Support Services Division, as well as the Legal Support Services Division. So yes, I have a lot of things to do every day. No shortage of things. But as David said, we had a great time out there. Met some actually everybody we met was absolutely amazing. But we did hear some very specific things. We went out with a lot of things we knew that you guys needed to learn. We'll talk about a few of those things here, just as a set of topics. We're not going to get into actual information and training and stuff. We'll be doing that for you later. But we did learn about a lot of other challenges, issues, problems that APPs are dealing with across the country, and so Advize is we're going all in on helping APPs because we believe in you and we believe in your entire sector of healthcare and we believe in your place in healthcare. So when I was up first on a 2-hour session on the pre-day, the day before the conference, like a pre-conference, extra day. I don't know. Long day. It's been a long day, everybody out there in TV land. Anyway, so I was speaking on hot topics and legal issues with APPs. And and David and I coordinated. He was the next day. He was the first day of the conference, on the first day of the conference. He wasn't the whole conference. He could have been, but he wasn't. But he was on the first day of the conference. And so one of the first things that I spoke about, and then David kind of did like a component piece, companion piece, as it were, in his presentation the next day, was documentation. I talked about it from the legal perspective and, how if it isn't documented, it didn't happen for the purposes of fraud, for the purposes of keeping up with and being in compliance with the state requirements. Every state has a statute that requires that a full and complete and accurate medical record be kept at all times. So I had a lot of legal issues with that that can, go follow you into medical malpractice lawsuits, can follow you into licensing complaints, and a number of other things. David took a different tack, and tell us what you kind of what you talked about.
So my portion of the conference was talking really about incident to reporting and billing, as well as split and shared services. So how can the APPs work alongside the physicians in order to make sure that encounters are getting billed appropriately, as well as documentation, just like Julie did about that documentation piece and how important that is to have within the medical record. So, a lot of people don't like incident to billing or split shift services, really, just because of the complexity of the documentation. So, it was a really good chance to go over that with the APPs and also get some feedback from them with regards to what they're seeing on their end as far as challenges working with the physicians, which, it was surprising. And I'm pretty sure Julie can attest to this too. It was surprising how many issues that, arise from just the piece of, like working alongside the physicians and getting those services documented appropriately. I know that one of the things that came up for me during my presentation was how can the APPs really get recognized for the services that they're providing. So I think that, like Julie said, as we are going to be moving along with different sessions and working alongside these APPs, we're going to kind of help them with that, as far as how they can do those types of things. So very excited. So it was really, really
And we
good.
both talked about what is proper documentation. Just because you hit the keys on the keyboard or you slap a pen down on the paper doesn't mean that you're doing it well. So in my presentation, I actually went through, what it is that is necessary, and actually we went through and kind of did a simulation of documenting and all of the different pieces that are there, and basically taking the way you do it now and then getting the extra pieces into it so that you're hitting everything, and then that makes people like David very happy campers when you do that. Yeah, exactly. Yay. And if it, God forbid, ever hits a desk of an attorney who has to defend you in anything, whether it be an audit defense or licensing or med mal or whatever the case may be, it makes us happier too. So, good records are your friends, and better to spend a little bit more time on that, because it saves you all the money and the hassle and the grief and the time when it comes to something legal that comes down the road. It may just prevent the whole situation just because you had good documentation. So we also, again, we kind of tag teamed on this, on coding and billing and fraud. Those are three separate things, but sometimes they're all the same thing, all at once. How efficient. The government thanks you for committing fraud because it keeps them in business. So anyway, I talked about fraud and the effects of fraud, and how you can be committing fraud kind of accidentally. How sometimes the situations with shared services and things like that, if they aren't documented correctly, if the time wasn't spent, if things aren't signed, that is picked up as fraud. So I'll let. So anyway, it's a whole long story. It's a whole long bunch of stuff. But nonetheless, I'll let David kind of pick up on that, since he's the guy who finds those things. So
yeah. And adding into that, so thank you, Julie. Adding into that, it's especially with the fraud piece, want to make sure that the physicians are not just signing documentation saying that they're doing something within those services and they're not actually doing it. So as an auditor, I see that lots of times. I know recently I've had multiple cases where I've looked at where it's clear that the physician hasn't seen the individual, and all of the services are being rendered by the APP. So that's something, like Julie said, straight, that's not acceptable. You're not supposed to be doing that. Also templated issues that occur as well. So even though templates are not forbidden, each encounter should be unique to that particular member's needs and also of the encounter that's happening on that data service. So again, making sure that the documentation is supporting whatever is happening in that particular day, and not necessarily something that's going on, 6 months, previously, and there's no actual record of that actually happening. So I don't know how much we can stress document. That is probably the most important thing in all of this, is making sure that your documentation is correct, accurate, and comprehensive. So an auditor like me can come in and say, oh, look at that. This happened because of this. So there should be a why. So we're going with the why. Why is this happening? Why is this important? Right?
Why do I need to do this?
Why do I need to do this?
Why can't I be sleeping instead? Why? Yeah, the why thing, like for every section of my presentation for two a little bit plus 2+ hours, there was a whole why section, and we went through and I showed all the different areas of law that particular topic could touch, alone or in, multiples and groups, because there is, like the one thing that I cannot stress is no risk exists in isolation. So if you make one mistake, it has a ripple effect. Always. There's always at least 2 other areas that are also disastered, so we try and stop the stone from hitting the pond is the goal here. Now, just a few other things that I talked about. I talked about the legal effects of burnout and long hours. Now, APPs work long hours. There's just no two ways about it. And, you wouldn't all be doing that if we had more people in healthcare to begin with. We're very, the whole industry is very short staffed. And I talked about just a number of things. There was employment law issues, there was contractual issues, there was a number of things. But one of the things that I talked about was AI, the use of AI now. And this again crosses between us, which is why we were both there. But the AI is not the panacea for getting out of working long hours. It just isn't. And one of the things that we saw that we kind of rolled our eyes at, and we understood why people were doing it, but we were frustrated that they didn't know not to. And that is using AI like ChatGPT, not picking on them, but just as an example, ChatGPT to do medical necessity letters and just let it write it. Now, if your documentation is kind of crappy and it's taking the information from that document, now your letter of medical necessity is crappy and you didn't write it, so you can't really attest to it. And if you can't attest to it and you couldn't stand there and defend that in court, every word that was in there and said it came from me, then that's a problem. That's a legal problem. It's also potentially a fraud problem. The other thing was that we saw coordination of care letters that are being done where you're trying to update, coordinating practitioners, and those were, 2-bit as well. And you could kill somebody with that. ChatGPT just isn't there yet. And so those are things that there are other areas of healthcare where we're much further down the road with AI. But coding, I wouldn't. I don't know, David, you tell them whether you think they should be using AI and letting it code for them.
And that's a really good point. And it's interesting you bring that up because I just had a meeting this morning, like a conference, a webinar about AI and kind of like what is happening in that space in healthcare. And to be honest with you, the main point is AI is only as good as the people who create it, right? So if, like you're saying, if your documentation is already crappy, if your documentation is already inadequate, the AI is just going to pick up on that and make it worse, right? It's not an end all. It's not something that's supposed to substitute that human interaction that's supposed to be happening within an encounter. So it is supposed to be supplementing, right? So people use that, and so AI, it's becoming a thing, right? ChatGPT, it's becoming a thing. So I don't know where it's going to lead, but I do know that, like you said, it's not supposed to be used for kind of the end all for that documentation piece.
And really with some of these things, if you're using it to do your chart entries, this is not going to hold up. And really, there is no lawyer who's going to be able to defend you. And if you're using coding software and CPT codes change, okay, which they do all the time, and you don't get the updated version. First of all, if your coding is wrong, you're responsible for your coding. I don't care who does it. ChatGPT, your medical assistant, your dog, I don't care who's doing it. You're ultimately responsible for it, and you're on the hook for it. So, what am I supposed to say? I'm sorry, but ChatGPT did it. And they're going to say, don't really care, whether it's the government or a payer. And they just don't care. And what am I really going to say when the CPT codes changed and there was a new version of whatever the AI is, and you didn't have it? And then you say, oh, well, I didn't have it. They changed and my software didn't change with it. Well, guess it still needs human interaction to do the update. And it just is, there's no defense for it. You're still responsible for it. You're responsible for double checking it and everything else. So we did the whole AI thing. I got into some of the tech burden, just again, keeping up with updates, one of the banes of my existence, computer updates, software updates, drives me crazy. So bad that, like the whole software will stop working before I have to take time out and do 97 updates, right? I know you're out there, you can commiserate. I get that. You're like, I'm with you, sister. And we talked just about all the things that you have to keep learning. There's always new tech for this, new tech for that. And there are actually potential legal issues that come with that. We talked about medical malpractice, of course. I mean, that's standard thing. I talked about using the term doctor if you are a DNP. I'm not against it by any stretch of the imagination. As somebody who holds 2 doctorates myself, I am not against it. But there are ethics rules, and there is a certain amount of uh, uh, incrementalism that needs to go on, and public training, so that, because the whole point of licensing, this all comes down to licensing rules in their states. And the whole point of that is to keep the public from being confused. So when DOs, and there was the big thing about DOs weren't as good as MDs, and some of you aren't old enough to remember that. But there had to be like massive campaigns for like 5 years to explain to people that DOs were every bit as good as MDs. And so don't look down your nose at them as secondhand, care providers. And that needs to happen with DNPs so that they can use doctor. Now, there's many instances you're teaching, you're lecturing, you're whatever it is you're doing, use doctor, knock yourself out. I'll stand there and applaud for you. But just watch when you're using it, and just check your licensing statute. That's the real thing that's going to get you. And remember that some of your private organizations may have ethics requirements that you've agreed to abide by. And in some states, and actually more and more states, the legislatures are adopting the ethics codes of various professions as statutes. And so if you violate the ethics code, you think you're safe, but you need to know, is it now a statute in your state and a requirement? I talked quite a bit about licensing and licensing violations. And I got a whole lot of people who did not understand this. And so I'm going to be on kind of a tear to make sure that everybody understands licensing. And as a licensing defense attorney, it's a whole different ballgame than med-mal. And everything can end up at licensing. So if you had a criminal fraud, that doesn't necessarily affect a med-mal case, but it sure as heck affects your license and ways to keep your license and keep them, clear. And that led me into talking about the exclusion rule, the federal exclusion rule. And I was sitting there with, way too many APPs who are executives, who are brilliant, accomplished people who did not know what the exclusion rule was, which I guess is sweet that, you didn't know, and you've never encountered it, but scared the,
Right.
pants off me, because I was like, oh dear God, you have to know, because things can happen to you that weren't your fault. And then you're excluded from, basically ever working in the healthcare field again. I talked about employment and labor law. There's a lot going on in that right now. And that even if you're a leader and you're a manager or supervisor, whatever, it's important to know that and not leave it all to HR. They don't understand the legal ramifications, and again, the ramifications and consequences for your license. So, what else did you talk about, David? I'm just rambling on here.
Oh, no. I mean, you pretty much said it all. We had a whole gambit of stuff, and really it was really focused on that documentation and making sure that you're covering yourself when you're providing those services. So like you're saying, licensing, NPI issues that stem from not documenting split and shared services appropriately, right? Like, so that particular practice in itself is all about substantive portion of the service. So who's spending the most time with the member? And so if the physician is attesting that they're spending 30 minutes with the member and they're billing under their NPI, but then the documentation supports that the, PA or the NP actually rendered most of the service, and the physician just spent 5 minutes saying, "Hey, what's up? How you doing?" Then
How's
who's
the wife
supposed
and
to be
kids?
right? Like, then who's billing for that service? It should be the NP or the PA. It shouldn't be the physician. So, like you're saying, covering yourself with that, and those misuse of NPI issues, they can lead to licensing, exclusions, things like that. So it's something that is like you're saying, it's interesting that they didn't know about it. It's great that they didn't, because that means they never had to encounter it. But for those people who understand what that means and how that can affect their livelihood and their careers, it's a big deal. It's huge, right? So
Yeah, the exclusion rule just about killed everybody that right then and there. There was a lot of fear going on. I looked like I was definitely, a fear mongering lawyer, but that wasn't my point. I had a few other things, but one of the bigger ones was talking about compliance plans and compliance programs, full programs. You're required, it's mandatory under the PPACA, the Social Security Act, and if you're a Medicare or Medicaid provider, and also under a lot of private payers require this, and you have to have it. And it is disastrous if they come knocking and asking for anything, and they find out and they ask you, do you have one? And you say no. And or they find out independently that you don't, and that it isn't a living, breathing program. So we're going to talk about more of these things going down the road, but we're kind of running out of time. So what I want to say is, Advize Health is going to be your partner out there, APPs. We're going to support you, and we're going to educate you, and we're going to train you, and we're going to be there to help you and answer a lot of questions in a variety of realms, not just billing, coding, fraud prevention, and legal, but in quality and auditing defense, and just 1.5 million other things. So make sure that you keep us in mind. If you belong to a state or national organization, you want us to do any training or do virtual or come and speak at conferences. We are very fun. We're very practical. We give a lot of good resources and things that you can use, and you can step right out of our sessions and go and put those things into practice right then and there over the phone if you want to do that. So thanks, and you'll be seeing more of us, and certainly send us, I'll put our emails up, our Advize emails, and send us your questions, send us your issues and your problems, and we'll see what we can do to address those things in the larger context, not specifically your situation, but we can address them in the larger context, and educate everyone on that. Because as I say in all my courses, if you have the question, there's a good chance somebody else has it too. So let's share the information.
Yes.
Okay, David, as always, a thrill and a pleasure to be working with you and presenting and educating. And we hope to meet every last one of you in the country. Every last one.
Yes.
We'll make a checklist.
Yes,
make sure
very
you're
excited.
There. Okay. Have a good one, everybody.
Bye.
Stay safe.
Bye, everybody.